helping make your life easier. Moms Every Day.
Hey there, welcome to Moms Every Day. I'm Hattie Cheek. We have Dr. Ray with us today from Cabell Huntington Hospital. Actually, a child's pediatric plastic surgeon. I say child's, but you know,
that's
pediatric
correct.
plastic surgeon.
Pediatric plastic surgeon who dedicates himself to children.
Very awesome. Okay, we need to learn more about that because I think that this would be the first. We haven't talked about that yet on Moms Every Day. So give us an idea of what it is that you do and what you specialize in.
So a pediatric plastic surgeon undergoes a long period of training, including oftentimes, at least what I did, 5 years of general surgery training, and then on to plastic surgery training, and then a dedicated, usually about 1 year fellowship in pediatric, sometimes cleft and craniofacial training dedicated just towards children. And usually when they open their practice, they dedicate at least half their time to childhood deformities, childhood injuries, or reconstructive efforts towards children.
And that's from ages 1 to 25, or just born to 25.
Through adolescence, yep.
Yeah, wow.
Up to about that age. And many of the people who do pediatric plastic surgery also assist with, for example, facial trauma in adults. But there is a feeling in the community that kids are not little adults, and that there is certain tools, certain techniques that are specific for kids, and that's where we devote our time and efforts.
Awesome. And you are new to town, so we'd like to welcome you all the way from Alabama. You've been here about 6 weeks, you said?
About 6 weeks now, yes.
6 weeks. You're going to be at the Children's Hospital at Cabell Huntington Hospital.
Right. The Hoops Children's Hospital, which is embedded within Cabell Huntington.
Right.
I am with Marshall University on staff there, and they've made some very strong efforts over the last few years in building this capacity for pediatrics and plastic surgery, and I was brought to help build on what's already been done.
Okay, all right. And then when you talk about the children's plastic surgery, what kinds of procedures are we talking about?
So as in all plastic surgery, it's sort of head to toes, right? So it's deformities of the ear, either that children are born with, or that they develop, or they were injured, cleft lip, cleft palate, misshapen skulls. Sometimes the children are born with the cranial bones that are not lined up right, trauma, and then extremity too, hands, legs. Oftentimes we work collaboratively with the pediatric orthopedic surgeons or the pediatric neurosurgeons, and not so often, but occasionally with the pediatric general surgeons for reconstructive efforts.
And a lot of these times, I'm guessing the kids that you would see, you said sometimes they suffer some emotional damage, not necessarily even just physical when they're coming to you. One
of the most tough things about growing older is when you get into the ages where people are comparing each other to others.
Oh, yeah.
And if you have asymmetry, right? If one part of you doesn't look like the other, whether it's the ears, your chest, something else, it's well within our skill set to help to bring those to a more normal balance. And so we do find ourselves working in that realm as well.
What do you see a lot in kids, at least, where they really do want to have something changed? Maybe they wouldn't be ready to say, hey, can we have this fixed, but it does bother them?
I would say prominent ears is very common.
Okay.
Some of the more rare conditions, sometimes young women grow without symmetry, and that can be a very difficult thing for them, and they find their way to our office as well. Probably the most obvious is usually the children born with a cleft lip, which you can see from the time of birth.
Right.
And I think it's one of the procedures that has sort of the highest immediate impact. You can see right away, the same day, the difference.
How old are kids coming in usually with the cleft lip?
A cleft lip should usually be referred to a cleft team very soon after birth, because there can be feeding issues and other things. Again, pediatric plastic surgery works a lot in teams because it's not just the surgeon, it's the speech people, it's the hearing people, it's everybody else. And that's the other characteristic of our job that's very common, is we do work in collaborative teams within hospitals and with other multidisciplinary groups. But usually we would fix a lip at age about 3 months or so.
Okay.
And then for a palate, and the part in the back that helps you to speak and to eat, usually between 9 to 11 months. The other thing that I've seen in places I visited is once a cleft team is established, very commonly we see teens who were fixed with some of the older techniques come visit us to to use some of the more modern methods.
Yeah, because things are always changing.
Yeah, they grow over time, things shape over time, and they likely had the best effort.
Yeah.
And there's oftentimes things we can do to improve where they are.
Oh, that's good news. So if something has happened, maybe you're growing out of the surgery that you've had done before, then you can always give a call to Dr. Ray at Cabell Huntington Hospital and the Children's Hospital that's inside of there. Of course, if you need any more information, you can just head to our website, which is WSAZ.com. Click on the Moms Everyday tab. You can rewatch the interview when you click the As Seen on TV tab. We have more Moms Every Day coming after the break, so stick with us. We'll see you in about 5 minutes. Have a good one.